This week, South Africa faces a potentially devastating blow to its medical research capabilities. Over 800 million rand in funding from the United States National Institutes of Health, NIH, a lifeline for HIV and TB research, could be withdrawn amid escalating tensions between Washington and Pretoria. The impact would be felt not just in academic circles, but in clinics, trial sites and communities where South African researchers have led global breakthroughs. Now, joining us to unpack this is Professor Ntobeko Ntusi, President of the South African Medical Research Council. Professor Ntusi, appreciate your time. Can you help us understand what's truly at stake with these possible cuts?
Just to clarify, the cuts are no longer possible. They've become a reality. The U.S. administration announced to multiple research groups, not only in South Africa, but all over the world, that funding for research supported through the National Institutes of Health would be cut. And in South Africa, this is a significant investment by the South African taxpayer to the tune of between 150 to 300 million US dollars. And so what is at stake here is the ability to sustain the excellence and impact of our research enterprise and ecosystem, which has been able over the last 3 decades to make seminal contributions that were good, not just for South Africa, but for the whole world. In addition, we also have at stake livelihoods with thousands of researchers whose jobs are under threat. But these are also the same scientists who contribute clinical services voluntarily to support our clinical programs, but also serve as supervisors of masters, doctoral students, as well as early and mid-career scientists. So what's at stake is really that there is an existential threat to the entire health research ecosystem in South Africa as a consequence of the cuts that the new US government is starting to effect.
Now, I can only imagine the mood in the sector amongst you and your colleagues. Just walk us through the emotions that you went through, and as well as some of your colleagues, when this information filtered that these cuts, which were initially imminent, have actually happened.
So we've known for quite some time now that these were likely to be effected. And I think many amongst us remained optimistic until the last minute that the a sense of responsibility and a sense of right would prevail, and that the US would begin to realize that in an increasingly connected world, being able to support science is beneficial, not just for a country like South Africa, but is really important for the entire global community. So, I mean, if you look at one of the latest advances in HIV, which is the demonstration of lenacapavir having 100% efficacy in preventing new HIV infections. That research was led and conducted from South Africa, but now benefits the whole world. And in fact, patients in the US and Europe are able to have access to that drug, while patients in South Africa are still not able to afford it. And that's one of many examples of the impact of the science that has been done here, which benefits the US and many other countries.
Professor Ntusi, does the success that you speak of add to the leverage that South Africa has to be able to reach out to other nations and other organizations for continued support of HIV and TB research?
Yes, it does. And I think it's important to emphasize that while South Africa traditionally has had strengths in HIV and TB research, the important contributions really span across the entire health R&D value chain, with important contributions in NCDs, as well as blue skies or discovery science. And I must say there have been many countries that have started to express their support for the local research enterprise, as well as those who are starting to see in what ways will they be able to support and ensure that the continued contributions and impacts of science in South Africa will continue for years to come. And so we are in conversations with foundations, with philanthropy, with research agencies and science councils from other parts of the world to see where we can find support to bridge some of the huge voids and gaps that will be left by the withdrawal of U.S. federal funding.
So the amount that we're talking about at the moment is 800 million rand.
No, so that's a gross underestimate. The amount that we're talking about, as I said in my opening remarks, is in the region of between 150 to 300 million US dollars.
So we're talking billions of rand here. Now, you've also indicated that when the murmuring started around the possible cuts, some of you were optimistic, but obviously there were conversations that had already begun. Now, when you look at the conversations that you're having at the moment, just how big is this gap that needs to be filled? What is that horizon looking like from external partners and funders? And what is available to us domestically?
I mean, it's a big void. As you will know, the United States government has been the largest funder of global health, accounting for about 80% of the investment in global health. And with that retraction, it leaves a void that no single funder can be able to fill. And so what this needs is a multi-sectoral collaboration between players in the private sector in this country, philanthropy, government, academia, and civil society, together with partners in other parts of the world, to really come together to see how we can find efficiencies in our research enterprise, to be able to talk about how we prioritize the requirements in science going forward, but also to diversify sources of funding and to see where we look for partners who are able to provide part of that huge support that we've benefited from our American friends for many decades.
I mean, 80% is a huge chunk. It's almost everything that's available to institutions, governments, across the planet. What are the implications globally? I mean, we've talked about South Africa and what it'll do to research, bearing in mind the incredible successes that we've enjoyed. But just give us a global perspective.
So, I mean, the implications are huge, right? So if you look at PEPFAR, which was the main funder of HIV treatment in many low and middle income countries. It supported the salaries of over 250,000 doctors in 55 countries and over 1 million nurses and community healthcare workers. So that's been immediately withdrawn. And in South Africa, as a consequence of that, we've got 24,000 community healthcare workers who are currently unemployed, and the government is looking to find a way of absorbing them into our workforce. Similarly, if you look at the way in which PEPFAR worked, it funded primarily two other agencies through USAID and through CDC. And USAID funding was substantial for programmatic support of care for HIV and TB in many, many countries, but also provided key technical support to governments. as well as funding research. And we've had huge programs that were very ambitious, trying to look at how we could eradicate TB or HIV through use of new therapeutics and vaccines. And all of those programs have been summarily stopped. And so the impact on the globe is substantial. And the benefits of both investment in research as well as donor and aid programs for the US, which looked at everything from sanitation to agriculture to climate change mitigation to tracking new infectious diseases outbreaks all over the world. Those have all been stopped immediately. And I think the world, feels both an increasingly unsafe place to live in, but also one that is characterized by receding global solidarity, which has been one of the key drivers of advancement
Professor Ntusi,
for our society.